It's 3:47, and I would entertain a motion to approve the agenda.
So moved. Second.
Been moved and seconded. Is there any questions or comments on the agenda? Seeing none, all those in favor of approving our agenda as posted, please say aye.
Aye.
Any opposed? Hearing none, we have an agenda. Can I get a motion to approve our May 14th meeting minutes?
So moved.
Second.
It's been moved and seconded. Any questions, comments, corrections, additions to the May meeting minutes? Hearing none, all those in favor of approving our May meeting minutes, please say aye.
Aye.
Any opposed? Any abstentions? Seeing none, we have approved our minutes. We're gonna move next to proclamations. So our first proclamation is Food Safety Month. We're gonna start by reading the proclamation, which I realize now, do we have copies of this in our packets?
Yes, we do.
So everyone has a copy of it. All right. Well, let's start with Lynn.
Sure. Food Safety Month. Whereas Thurston County is strongly committed to food safety and highlighting food safety's critical role in the health and well-being of our community members through the prevention of foodborne illness, and
whereas food safety has a direct impact on health, it saves lives and plays a vital role in reducing foodborne illnesses like Listeria, E. coli, or Salmonella.
Whereas every year, 600 million people fall sick because of around 200 different types of foodborne illnesses, the burden of such illnesses falls most heavily on the poor and the young. In addition to foodborne illnesses, are responsible for 420,000 preventable deaths every year. And
Whereas in Washington State in 2022, there were 45 foodborne illness outbreaks, making 343 people ill. And the Centers for Disease Control estimates almost 48 million people become ill and 3,000 people die from foodborne illnesses in the United States each year. And
Whereas everyone has a role in ensuring food safety because safe food preparation begins at home with 4 basic steps. 1, keep food and surfaces and your hands clean. 2, keep raw meats and other foods apart. 3, cook foods to the proper temperature. And 4, put food away in the refrigerator right away. And
Whereas over 1,000 permitted food establishments in Thurston County provide meals and groceries to the public every day, working in partnership with local, state, and federal food safety inspectors to provide quality food in a safe fashion. And
Now, therefore, be it resolved, the Thurston County Board of Health hereby proclaims June as Food Safety Month in Thurston County and encourages community members to make food safety a priority and raise awareness about food safety.
adopted this 11th day of June, 2024 by the Board of Health.
Yeah.
All right. Well, I believe we have some guests joining us to talk a little bit about food safety. Is that right?
Yep.
Jesse Smith from our Environmental Health Program. Leslie Price. Please join us at the front.
Hi, I'm the Environmental Health Program Manager for Food and Environmental Services. We have 8 environmental health specialists in our program that do most of the inspections and are dedicated to food safety. We have our senior environmental health specialist over there in the audience, Tyler, as well, and then 2 program assistants. Our inspections are risk-based, focusing on the things that are actually going to make people sick, not as much spending time on are the floors dirty, those kind of things. We respond to complaints, illness issues, and really try and provide a lot of education as part of it. Didn't really have a lot of words prepared for you or anything. We're just hardworking staff that are trying to do our best to keep people safe. But I'm happy to answer questions if you have any. And then this is Leslie. She can.
Hi, I'm Leslie Price. I'm a public health dietitian.
And I help out in the food safety arena with some messaging we do on our social media. Usually I've written a couple articles. It's also a passion of mine. And as a dietitian, see, food nourishes our bodies, but if it can't nourish our bodies if it makes us sick. So be sure to practice safe food safety. And a couple things, just we're coming in, our grilling season is upon us. Remember to wash that grill with soap and water before you use it. And say no to raw dough. Those are my 2 tidbits. I grew up eating raw dough out of the bowl, cookie dough, bread dough, and now I will not touch it because the eggs and the flour in it can make you very sick.
That was something that I learned late in life, that it's not just the eggs and
Yeah,
raw dough
me
that
too.
are the risk, it's also the flour.
Yeah, that was a few years ago. There was a big recall over E. coli from raw flour. It's making Christmas cookies really sad now.
Can I ask a question?
Please do.
If hypothetically, I didn't wash the grill with soap and water before I used it, what would be the health
Turn on
risks?
high.
Well, I mean, what's the risk that you're facing?
I mean, I suppose it depends on what temperature you're getting your grill to and what's on there. I mean, you know, if you got some bad chunks of food on there harboring bacteria, there's some risk there. I mean, on a grill, you know, it's regularly, because of heat, cooking any bacteria on there and viruses. So for the grill, cleaning it, if you're cooking it a lot, I wouldn't say that's probably your biggest risk point. It's probably more the spatulas and the handling and the other things. Like, are you using the same tongs for putting the burgers on the grill that you're using to put on your bun and stuff like that? Then if, you know, you're doing a hot cook. But it's also, some of it is, do you want chunks of charcoal on your food and different contaminants?
Is there anything else you want to share with the public about food safety, especially in the summertime? We mentioned it a little bit in the proclamation, like refrigerate your food, make sure you're not leaving it out too long, especially in warm weather.
Yeah, I mean, certainly, if you're going out to events, making sure you have plenty of ice, you're keeping your foods in separate coolers. If you got a cooler for your raw hamburger patties you're gonna cook, getting those salads, those macaroni salads or potato salads refrigerated. Don't leave them on the counter don't leave them on the counter for more than an hour or two, and, you know, get it back in that fridge as soon as you can, or buried in ice. Like, people will often just put stuff on top of ice and call it good, but, you know, really getting it in there and just watching, you know, when you're out and about, that cross-contamination where you're touching the raw stuff, and then you don't necessarily, if you're not in your kitchen having a good hand washing setup.
Wear sunscreen while you're grilling.
Yeah, certainly another safety.
Less of a food safety
Gary
thing,
lectured me about that earlier.
general
mean,
personal safety.
If I'm ever cooking like raw chicken or stuff like that myself, I always bring my digital thermometer and verify temps, you know, to verify it's cooked and also to verify I don't overcook it, so.
Okay. Question?
So if we or the public wanted to see how a restaurant inspection had gone, is there a way to look up and see like how a particular restaurant is performing?
So we have an online inspection reporting system, so you can go onto the website and look up the results. If you want to look up the actual inspection report, they are all public record, and so they can contact us and do a records request and get a copy of the inspection reports. But we do have a restaurant inspection search page on the health department website to go look up every permitted food establishment.
Commissioner Edwards, and then,
I guess I'd just point out that you folks must be doing a great job, because I've been eating out around here for a long time. 'Cause I've been around here a long time. And I don't know that I've ever gotten food poisoning, so thank you.
That's great.
Thank you.
Happy to hear
You've
that.
been doing good.
Super.
I want to thank you too, because I notice how frequently, by reading these reports and things like that, you're balancing people's needs to do business and also to have fun and celebrate, and it's a nice balance, and your work is not missed, people in the community see that.
Yeah, we try to work with our establishments, not just come in straight with a hammer or anything like that. We want them to succeed.
Well, thank you very much for your work.
All right.
And for coming to talk to us today.
Thank you for having me.
Want to take a photo? Let's take a photo. The answer is yes. Let's do it. With the nice posters of the people behind us.
I love that.
I know where I got it. I know where I gotta go.
This is jazz hands.
Is that like a jumpsuit?
You can balance out down here. Oh, and Carrie, I can you just down a little bit.
She's like, Wayne, get a
Yeah,
little further away.
okay.
This is done.
Oh, dynamic photo.
1, 2, 3. 1, 2, 3.
Good job, everyone.
We have 3 copies.
Wonderful.
One's for you.
Alright, this is like a, let's see that. Okay, that's cool. That's cool. Fancy, fancy.
They're free to.
Those are the best pens in town.
All right, we're gonna proceed to the next item on our agenda, which is another proclamation. And if I could find my own agenda, maybe. Hey, thanks. So we're working on a proclamation for Composting Awareness Month, and I did want to mention, we have a schedule for providing proclamations at the Board of Health meetings, just like the commissioners do during their Board of County Commissioners meetings. And proclamations are valuable just because it is an affirmative way for this board to express the things that it wants to prioritize or wants to draw attention to. So I've had people ask, like, what is the point of a proclamation? But I think it is a valuable way for any elected board or part of the government to say, like, this is something that we care about, and we want to make sure that folks are aware of where we stand on this issue. So let's start with Dr. Harvey this time for Composting Awareness Month.
Right. Composting Awareness Month. Whereas Thurston County is strongly committed to reducing climate impacts, increased carbon dioxide emissions related to excessive food waste and disposal of food waste in landfills, and
Whereas Washington State's organics management law requires reduction of emissions of methane created when organic materials like food and yard waste decompose in a landfill, and
Whereas the law set forth milestones to rescue 20% of previously disposed edible food for human consumption by 2025 and divert 75% of previously disposed organic materials from landfills by 2030, and
Whereas utilizing a phased approach, the law requires organic materials management services for businesses generating at least 8 cubic yards of organic material per week in 2024, 4 cubic yards in 2025, and 96 gallons in 2026. And
Whereas composting provides effective tools immediately available to tackle climate change, food security, and soil degradation. And
Whereas Thurston County's Public Works and Public Health and Social Services departments partner with the Department of Ecology to provide education and outreach to the general public and to businesses in Thurston County to increase awareness of the law and how they can best comply. And
Whereas by proclaiming June 2024 as Composting Awareness Month in Thurston County, we recognize the critical role that composting plays in creating a sustainable future for our communities. And
Now therefore be it resolved, the Thurston County Board of Health hereby proclaims June as Composting Awareness Month in Thurston County. It encourages community members to learn more about this topic to promote composting in the community, adopted this 11th day of June 2024 by the Board of Health.
Thank you. All right, and I believe we also have some folks here to speak to us. Kimberly Graham from Hazardous Waste. Join us at the front.
We have Public Works staff with me as well.
Great.
So yeah, thank you for giving us the opportunity to speak on the subject. Composting is an essential factor in the success of the Washington State Legislature's 2021 Climate Commitment Act, which aims to reduce carbon output. The Organics Management Law was created to support the success of the Climate Commitment Act, and once fully implemented, the law will reduce landfill waste, mitigate greenhouse gas emissions, namely methane, promote sustainability, enhance soil health by increased production and use of compost, and support circular economy where organic waste is repurposed and recycled, reducing impacts to the environment. And so at the local level, Thurston County Environmental Health is working with the Public Works Education and Outreach Team and Ecology to identify the businesses affected by this law and to educate them of the requirements and what they can do to not only comply, but also reduce their waste output entirely.
That's really cool. How's it been going so far?
It's really in its early stages. There's been a lot of collaboration with the different teams trying to figure out how we're going to figure out which businesses this affects, which ones we want to work with first, and then how we're going to cascade down from there.
If I had to guess, I would guess that hospitals and schools are some of the largest producers of food waste because they feed a lot of people.
Right.
Is that right? Are there exemptions in the law? Like, are any of those big producers of waste exempt from this law, or are those some of the folks you've been working with?
Not that I am aware of.
No, I'm Scott Keith. I'm the Communication Outreach Supervisor at Public Works. No, there's currently no, other than the, as that's kind of phasing in about how much they generate. And 8 cubic yards of organic waste a week is a lot. It's like a full dumpster, if you imagine that. And then, we provided some outreach to businesses through mailers, and we have a website on or a webpage on the county's website where business owners can go to learn more about the requirements.
Have any businesses proactively reached out and said, I want to do this? How do I start doing this?
We've had a couple, and then Maggie Brown, who's new on our team, she's going to kind of pick up the torch and lead a lot of that outreach and do the technical assistance visits directly with the businesses when they have questions.
That's great. Have questions from the board?
I don't know if it's a question, but if you wanted to get everybody to clean up their plate, you're gonna have to put ice cream on there. Because if you'll notice, I don't think much gets thrown out at the ice cream shop compared to the school cafeteria. That'll be a challenge for you to figure that one out.
Yeah, we'll take it to the next meeting.
So you said Climate Commitment Act is where this came from? And is there funding coming from, that's helping us do this from the state, or are we funding this locally?
I'd have to get back to you on that. I'm not entirely sure on how all the funding's working, and that's another thing that's being worked out as well as far as following up for compliance with these.
What I'm curious about is, if the voters repeal the Climate Commitment Act, but we like this program and what we're doing with it, we should keep doing it. Now, maybe we can't because it's state funded and that funding will go away. But I guess I would like to have that conversation if we get to that situation. Hopefully we won't, but there's programmatic elements that, we could do locally, even if the state voters renege on their commitment to doing, or, take away the commitment to doing it statewide. But these are things that I think are important, so.
Yeah, funding helps, doesn't it? Dedicated, protected funding.
Absolutely.
All right. Any other questions or comments?
Thank you.
Thank you.
And now, a photo. Different people. We're the same.
Yes.
I don't wanna get in front of everybody, I'll get down here by the doctor.
Another round.
Sweet West told you it's not. We need a whole new building. In our new building, we'll have to put in a photo booth.
How many people can you cram in there?
Yeah, we need a green screen.
Limit. Shopping this picture.
All right. I'm done chasing people down with signed proclamations. Let's move on to the next item on our agenda, which is an opportunity for the public to address the Board of Health. Do we have anybody in the audience or online wishing to address the audience? I see Susan, I believe she is county staff. All right. Seeing and hearing nobody to address this board, we're gonna move on. Next item on the agenda, we have a presentation on loneliness and isolation in the community. This is something that we talked a lot about during last month's Board of Health discussion, and I'm really excited about this presentation. This is a really important topic.
Thank you so much for this opportunity to speak on this topic. My name is Brian Windrop, and I'm the Executive Director at Senior Services for South Sound. And you'll hear from my colleagues here on my right and left in just a moment. But we're here to speak on this topic that until recently we haven't taken nearly seriously enough, it turns out. And we are now aware that isolation and loneliness is, according to the Surgeon General, a national epidemic. And that report that came out last year was eye-opening to me, because prior to that in my family, when I had relatives who were isolated and lonely, we just thought it was merely a bummer. You know, it was sad. And we wondered why their health deteriorated so quickly, and we didn't really have data on that. And now we know, with more and more research, that being isolated and being lonely is as bad for your health as smoking and diabetes. But unlike those things, we don't yet grasp that it is bad for our health. That report said that only 20% of people surveyed understood that being isolated and lonely was bad for their health. They understood they might be sad about it, but they didn't know it was bad for their health. So we're here today with the Health Board, all you all, to discuss this with you because we believe there's an urgent need for us to educate the community and to get our fellow citizens to the point where they recognize that they themselves or their loved ones, if they are feeling isolated, feeling lonely, that something needs to be done about it, whatever possible, because it is not merely a sad situation. So as I said, I'm the Executive Director of Senior Services for South Sound, and we did an unusual step this year and adopted a theme for our organization, separate from our mission and our values and all those normal things we have, bylaws and strategic plans and all of that. We've adopted a theme to, among the senior community that we serve, to battle isolation and loneliness. And we've been doing that really since 1973 when we were founded. We operate the Olympia Senior Center and the Lacey Senior Center, as you probably all know, serve all of Thurston and Mason counties with Meals on Wheels and transportation and many other programs. So baked into who we are from the beginning has been trying to get seniors to live active, healthy, connected lives. But there's a new urgency to this now because of the data that I mentioned that shows that it is even a bigger concern than we thought it to be. And so we're here today because a county in California, San Mateo County actually, was the first county in the country after the Surgeon General report to declare it in that county a public health crisis. And that's what we're here today to ask if this county health board would consider doing that for our county. To our knowledge, this would be the first county in the state of Washington to declare isolation and loneliness a public health crisis. We believe it deserves that treatment. We know it is as much of an issue here as it is all across the country. We know that it is an issue, as you'll hear from my colleagues, among young people, surprisingly, and of course, among people who are the senior community that my organization serves. Not with us today is Cheryl Haywood of the Timberland Regional Library, and on her behalf, I would like to say that that organization is also partnering with this effort and is eager to be of any help they can be. I've met with the city managers of Olympia, Lacey, and Tumwater, and they're all eager to help however they can help as municipalities. I meet with the Lacey City Council after this meeting today, and I think everyone I'm speaking to is just nodding their heads, as you seem to be doing, and saying that they understand that this is a real issue. Many of us have family stories about people we have had in our communities of loved ones who ended up, for one reason or another, isolated, lonely, and might have had bad outcomes. I can tell the story that my own mother, after my father passed, as far as my brother and I could tell, she essentially died of a broken heart. Didn't make it a year past the time. She stayed at home, watched television, and had been healthy prior to that. And she was gone within a year at a young age, relatively speaking. So many families have that sort of experience of aunts and uncles and loved ones who had a really reduced quality and quantity of life because of isolation and loneliness. And though we know that this is a national issue, and though we know that there's many systemic issues in our nation that contribute to this, isolation and loneliness, I believe that anything we can do locally that can help individual people have a better quality of life and understand the risks of them being isolated and lonely is an effort worth doing. And so with that being said, I'd like to hand it off to Chris.
Thank you. I'm Chris Wells. I'm the Executive Director with the United Way of Thurston County. And as many of you might be aware, our focus areas are health, education, and financial stability for all people in Thurston County. And for us, this is one of our pillars that we focus on to achieve optimal health outcomes for all people. And I think, we focus in a lot of areas on health, but I think as the pandemic made us so acutely aware of the impacts of isolation and loneliness, when we had to be kept away from one another, when students couldn't go to school, when we were isolating in our homes, many people who live alone, students who couldn't be with their peers, it caused profound mental, emotional, and physical health impacts over that time. I heard a lot of people talking about the pandemic 15 or the pandemic 20, similar to the way we talk about freshman year of college.
COVID-19.
Right.
It's right there.
Right.
Yeah.
And
It's in the name. It was built in.
Right. And, I think that we're still experiencing those impacts. I think that we hear quite a bit about the lingering impacts of the pandemic, and perhaps one of the areas where we may be least attentive is in those areas of isolation and loneliness. But I think that we have some current data that indicates to us that this is something we really do need to be more attentive to, and that we need to mobilize the community around. I would point to our recent community health needs assessment that was conducted by Providence Swedish. If you've been able to sit in on that presentation recently, you would see increases in suicidal thoughts, ideation, gestures, attempts, and success. And if you look at our healthy youth surveys year after year after year, and the kinds of questions that our kids are being asked about whether they have a trusted adult, how connected they feel in their communities, that we can all understand from our various disciplines that isolation and loneliness really does need to be a big priority, and that it will require our whole community to come together and coordinate an effort to build awareness and create a response to it. Because in the end, communities in which people are connected and they feel they belong, and when they feel cared about, you have healthier communities. And so that's what I would ask this board to consider today as we move forward with a request to make that declaration of this as a public health crisis. Thank you.
Wow, just stunning stuff. My name's Kyle Kronk, President and CEO of South Sound YMCA, and we have YMCAs in Lewis, Mason, and Thurston County. And just like my colleague said, isolation is a big deal. You don't have to be old, you don't have to be young. everywhere in between. If you're not connected to other people, you're not as healthy as you could be. And it really is a public health crisis, as the Surgeon General said. We didn't need a public or a health crisis to have the YMCA figure out, like, bringing people together is what we've done for 193 years. And whether it's a mommy and me class, whether it's a Tai Chi class, you're doing that with and amongst people, because healthy communities need everybody. And again, like I said, everybody, we're way better together than if we're isolated and alone. And it's funny, when I've been here almost 10 years now, which is a little hard to believe, but when I first came here, even when I was interviewing, I met this older lady. She was probably in her, I would say, must have been mid-80s. And she came to the Briggs YMCA to celebrate her birthday every year, every single year. And so I met her when I applied for the job, got the job, and then every year until she passed, she had 9 birthdays at the Briggs YMCA. And they had it at the Y because that's where her friends were. She wasn't even a member of the Y anymore. She just came to the lobby to have cake. I mean, it was that big of a deal to make sure that she was in community with her people. And so those stories happen in every YMCA across the country. They happen in every senior center across the country. They happen in every, every way that the United Way supports community. Gathering people, we are social creatures. We're not meant to be in isolation. So it's no surprise that people are less healthy, stressed out, anxious, and don't last as long because they're lonely. So yeah, I'm thrilled to partner with my colleagues here. I love partnering with the community. I mean, one of the biggest ways that we can do more is to be together, and that collaboration and partnership makes a massive difference. So thanks for having us here today. Thanks for having me here today. I love it. Love all the photos and the proclamations and all the fun stuff that you're doing. So thanks.
And I would wrap this up in our comments to say that there's 2 words that we've used at Senior Services to organize ourselves around, and I think they might be useful to the health board. And that is that within the theme of battling isolation and loneliness, we focused on raising awareness and taking action where we can. And I'd like to highlight that in my organization and in United Ways, I know it in YMCA, none of us have budgeted separately for this.
No.
We don't have to, really, because it's built into who we are and what we already try to do, but it changes our messaging. So in our newsletters, we've been hitting this hard, and in our other activities, we focus on how we can connect people even more than we have. And so raising awareness, taking action, I think is an appropriate series of words for all of us in this endeavor. Thank you, and any questions we'd be happy to answer.
Well, I'm guessing we're gonna have some questions, but I wanted to offer a couple of comments. I think one thing that has been apparent to me is that COVID-19 it did create some problems, but more often it showed us the vulnerabilities in the systems.
Sure.
This issue with loneliness and like the decrease in places where people can go to be in community with others is a trend in American society that's been studied, right? The bowling alone phenomenon of like fewer fraternal organizations, fewer community clubs, lower church attendance. There are still places like the Y where people can gather, but it's not. Fewer and fewer people, I think, take advantage of those shared spaces in the way that they used to. And so what's been on my mind as you talk about, partnering with the Board of Health to issue a crisis statement, like to declare loneliness and isolation a crisis, is what can we do to reverse this trend that's been going on for a long time? Because we have tools that can be used to create awareness, right? We have communication tools, and maybe that's a piece of it.
Mm-hmm. Yes.
Yeah. Think you have something?
Well, I would just say that 1,000%, I mean, the awareness and making sure that people understand the impact of what it means to be in isolation and lonely, and that there are solutions to it, like being with people is a thing. I was looking when you said that, when Brian, you were saying about those 2 things that you said, it's built into the vision of the community.
Yeah.
The community is better together. And it's way better when you're, dining with people and you're out and you're at festivals and you're doing these things. So where can people gather? Where can you get help if you really are, isolated all the time?
And to your point, in my day job, I work for a public health agency for the state. And We have massive programs to try to discourage people from smoking. We have massive programs to try to incentivize healthier diets to decrease the incidence of diabetes and prediabetes. We don't have that yet for loneliness and isolation, but it seems as though we may need to start thinking about it like that, like a program. So, hand over here, Commissioner Edwards.
I understand the awareness part, and I think we can deal with the awareness part pretty well. I don't know what it really means on the taking action. Do you have some examples that you really feel would be beneficial? I mean, the chair mentioned that, you know, maybe we missed the boat on COVID a little bit, keeping people too isolated. We see that with our kids and stuff. I think about it with the seniors that were kind of stuck home for that long period of time. We'll never know how many of them died of a broken heart versus some other illness, I guess. But so what do you think as far as what does really the term taking action? I mean, a random act of kindness. I mean, that's taking action, but what can we do as a group or as a board that would help pass the message around? Because I guess the messaging is going to be a part of it, but I don't know. They have senior games or something like that. That's all I, you know, for the older folks, or Little League baseball for the kids. So what are you promoting at this point in time? Or maybe you haven't even thought it out enough. I don't know. I haven't.
Well, yes and no to that. So I would say, you know, first comes the messaging. And I think there are probably very few people who would even be aware of the profound physical impacts of isolation and loneliness. So a coordinated messaging effort across all of our various constituencies, partnering with public health.
We need a slogan.
Yeah, better together is good.
Yeah, that felt like it rolled off the tongue.
Right, it's right there. I just wrote that. Write that down. But in addition to that, you know, how do we leverage those assets that we already have? Those community organizations, community activities, how do we lift those up? And how do we tie those to that message of connected communities and encourage people to get back out into the world and participate? Encourage people to check in on their neighbors. You know, how many people even do that anymore? I think part and parcel of the messaging is also a routine call to action in some way, in ways great and small. Maybe we can even create more community events. As Brian was saying, you know, he's met with the city managers of Lacey, Olympia, and Tumwater, and he's meeting with the Lacey commissioners this evening. And other groups like this. I mean, part of the way we can leverage our public representation is not only the buy-in in the messaging and the advocacy, but then we do have community assets that we can utilize. And as the organizations, the four of us, including Timberland Regional Library District, and others we can bring into this, we have assets and constituencies also. So together, you know, all braided together, that's the community right there. And I think one of the greatest things we can do is through that collaborative effort and shared consistent messaging across our different platforms and constituencies, with those calls to action, and then we kind of go from there. As you said, it's not, we don't have this all mapped out over the next 3 years, but we know that it starts with the message, and it starts with making this an official acknowledgement in our community that this is an important focus for us as a community, and from this point forward, we want to make the community aware of it, and then we're taking steps as a community to be a healthy, connected community.
Yeah, I have a couple of questions. So I guess just I'll follow up first with Commissioner Edwards' questions in terms of like, you know, when I look at it, I want to see the data of like, well, how many people in our community are affected by this? And then if we're going to be doing a declaration of crisis, like what are the success metrics? How is this even measured? And how do you even track it, right? And understanding, you know, it's a lot of it has to do with awareness. It's not like you can go to someone's house and be like, get involved in the community in some way or another, right? It just, it's not going to happen. But how does one, right? Because we can do a declaration, but, you know, it's going to be a meaningless declaration if it's just for, you know, like how do you actually know how do you track the success of something like this?
You are singing my tune. It's my favorite thing ever, and that's data. I do think that this is quantifiable. I think it's measurable. And I think another great tool that we have at our disposal are things like the Healthy Youth Survey and the questions that are developed on those. We've always had great cooperation from Public Health and Social Services in thinking about the questions that we might want to add or new things that we might want to measure. But then when we think about the different organizations who can be involved, you know, we can craft simple surveys. We have thousands of people who have opted in to receive communications from United Way. So we can create a simple survey.
And
Seniors
YMCA,
could be surveyed.
and senior services.
YMCA members could
And the
be
library.
surveyed.
And the library.
You know, we can conduct a public survey and just ask people questions to try to measure their feelings of connectedness in the community, or how many, you know, times during the year, you know, there are simple questions you can ask. Like, if I had an urgent need right now, if I had an emergency, I know there are people I can call who would come to my assistance. That's a really simple question to ask people, and a lot of people might say, no, there's nobody I could call, right? So I think that we could craft a pretty simple survey that we could send out to measure it in the beginning and try to get a baseline across a number of constituencies. And I think that, you know, in a year or 18 months, when we've done this messaging campaign and when we talk about things like checking on your neighbors, or, you know, how you engage with your child in their school or with their pediatrician or whomever, you know, that we can come back and do that same survey sometime later and across those same respondents and see if we have been able to impact that to any degree. I think there are some other things that we could be able to try, and we can certainly do some research into that, but we have a lot of means of sort of measuring community sentiment around certain topics, and we've done it in the past.
And I'm glad that we brought the data person with us too. We can also mirror the Surgeon General. I mean, as a starting point, it's not super tough. We could just
They
figure
have
out
a survey that we could crib.
I wanted to emphasize, I think that I tend to think globally and act locally. And it's easy in these situations to feel despair about how could we possibly do anything on this. And this is not a new problem, right? I remember when I was a kid, my parents both smoked, and everyone I knew, all the parents smoked. And I was a child of the late 60s and early 70s, and there was massive campaigns in the school. They showed us pictures of lungs from, you know, and it scared the hell out of me, and pardon me, but it did. And so I think it's easy to throw up our hands and struggle with what to do. And yet, when I see the data that 20% of Americans understand that being lonely is bad for their health, that tells me there's enormous progress that can be made in just getting the public to the place where they say, okay, yes, it is bad for our health. That would be huge. And we can measure that, as Chris said. You could survey that quite directly. This problem didn't happen today. It didn't start yesterday. We're not going to solve it tomorrow. I reassure myself about those sort of things as an executive director, right? That some problems are long-term. And it doesn't mean that they're not worth taking action on. It just means that we shouldn't expect simple solutions to problems that are deeply systemic in our society, from our use of the automobile to the building of suburbs. I mean, it goes down to the origins of.
And how long did it take for people to start wearing seatbelts?
Yeah.
I mean, when I was a kid, there was no seatbelts.
Yeah, exactly.
But, I mean, those are both excellent examples of how, even though it may have seemed like an almost insurmountable problem in the past, it happened, like we did it. People understand now the dangers of smoking. People understand now the dangers of not wearing a seatbelt. And it was because the people back then didn't say, well, this is such a big problem, we can't even start. Nobody said that. They said, we got to start somewhere. Commissioner Menser, and
Dr.
then,
Hardy,
no?
We've got, I'm sure we all have the same.
Who wants to go
Do you want to
first?
go first?
I'll let you guys are more,
Okay.
Dr. Harvey, please go.
Well, so I totally agree that this is what we're seeing, at least in pediatrics. And this week I had multiple patients where the real underlying problem impacting their health was that they were lonely and isolated. And we see this a lot in transitioning young adults. We see this a lot in parents with young children. We see this a lot in our special populations, like a lot of our young people with autism feel it's very challenging to make connections and feel connected. And this truly is one of the things I talk about with all of my patients. Like, if you want to have a long, healthy life and be one of those spunky 80-year-olds, like, not only do you have to do all these normal, like, eat well, sleep well, move your body, it's find connections and have meaningful relationships. So I think this is very important, and some of the metrics you could look at would be some of those special populations too. And I know the county does a lot of services for some of these, like especially the young parenting families. Maybe there's some special problem population work that you're doing there. But I think at least and this is part of why all the doctors and pediatricians at one point fought to get the kids back to school, is because we knew at some point we have ways to protect the teachers, and the kids are suffering and not thriving. And every single growth curve I see, you can see when the pandemic hit. Every single one, and they're all back down to normal when they're having connections and doing those things, going back into the community.
Just for you on your flyer. I'm a mental health professional by day, and I work with kids and families. There is so many arguments for this, of de-isolating folks, and it's been identified as a need in our communities for many years. As a matter of fact, our highest level services for kids in our communities is, part of the goal is to address their mental health needs. The other part of our goals are to address our isolation needs. The data around that is available already on the Healthcare Authority website for children in wraparound with intensive services. There's also, most of you have probably heard about Bessel van der Kolk. He wrote a very important book a few years ago. This is called The Body Keeps the Score, about trauma. And one of his basic assumptions in that book is that organisms, when they feel trauma, they group together. And it makes them less likely to be impacted by trauma, which makes it less likely for them later on down the line to suffer for stuff that's going on now. So I appreciate what you're doing, and I think it's really important, so.
I had a follow-up to something that you said, Chris, and it's just because I also love data. And that was, Commissioner Mejia asked the question that I was also thinking, like, how do we design metrics? Because if we were to issue like a declaration of crisis, we would want to be able to show that we're doing something about it, because there's not a lot of point to saying, well, this is a crisis. There has to be and these are the actions we're gonna take, and this is how we're gonna measure if we're getting closer to success. But I think that if we deployed a survey that would give us a foundational baseline, and we deployed it at places like libraries and the YMCA and churches, we might actually have a bias in the survey, because people in those places are already seeking community in a way that people sitting at their house are not.
Yeah.
So I'm wondering if we could think about deploying a survey also with employers, because people have to work. They might be full-time teleworkers, but the employer may have a way of reaching or deploying the survey, and providers. Like when people come in for an annual checkup for themselves or their kid, could we get a survey there?
That was actually the first idea I had was if healthcare providers could administer that survey, because that would make it easiest for us to go back after a period of time and survey the same respondents. So if we had healthcare providers across adults and pediatrics who are willing to assist with that survey, I mean, we know that physicians have very large practices, they're serving a lot of people, and they could provide that survey without violating HIPAA, just by, asking patients to either opt in, allow them to share that information, and maybe some demographic information, but no personal information. So I'm not sure exactly how that would work. We need to get feedback from healthcare providers, but I think providers are already surveying for so many other things. It wouldn't necessarily be a big lift. Maybe Dr. Harvey could fill us in on that.
Yeah, I mean, it's part of, a lot of us are doing social determinants of health, and some of these questions are on there, and it might be a way to capture some of it.
Kyle and Chris gave, an example, smoking their seatbelts and how long it took to increase the usage, which in turn probably increased longevity somewhere along the line. I mean, I don't know what it is now. Is it like for men, is it 73 or 4 or something?
A lot higher than it used to be.
Yeah, but it is, way higher than it used to be. I would almost think that if you attach a dollar sign somewhere along there, you could get insurance companies that would possibly promote this as a topic, because if they can get their masses to live a year longer, they make a lot more money because they get more premiums in. So, I mean, you know, there's actually ways, I think, that we could probably promote it, you know, short of maybe, I don't know, if you go to the senior center, you get a free lottery ticket or something. I don't know what would, you know, how we could do that and make it work, but I think there's probably quite a few different ways that we could work and get like corporate sponsors, like insurance companies. I mean, they just come to mind because a lot of us have insurance.
Dr. Harvey?
Is that okay? I'll make sure I'm not hogging it. The other thought I had is perhaps with Thurston County Parks or something, like you could sponsor some events, and then at the events you could check in, like, are there people who, you know, had any friends, and do they make friends while they're there, or, you know, like, there's just, I think you could be very creative, because depending on what age or what type of person you're trying to draw out, Meals on Wheels, I'm sure you could get a lot of data on some of the people that are more housebound, and anyway, I think it would be very interesting.
So it sounds like there's interest and a lot of opportunities for increasing awareness and maybe even supporting some activities, making some connections. I have a question for either Jen or maybe some of the county staff. The county has declared emergencies in the past. Procedurally, what does that look like? Because we have an ask to declare an emergency, or a crisis, which would then prompt us to put together some kind of action plan, I assume.
I don't know how Thurston County has done it, but typically they're done where it's like the health director or some sponsor will help organizations to pull together the statistics. So when we did racism as a public health crisis, pulled data into that to prove why it was a crisis. And so yes, using some of the national or whatever local data we could find.
As county manager, I think that's a great question. As the process and working with public health and our assistant county manager team continuity determine what is that process and what is the outcome, what are the allocation of resources, et cetera.
Since 2018, just for your information, there's been 4. Homelessness and opioid crisis was 2018, and then racism and climate change was 2021, I think. So those are kind of the most recent history of public health declarations of emergency.
That was going to be my next question. How many declarations do we have out right now? Right, and how much resources are we putting into those? Because I know we have a few of them out that.
The opioid resulted in a task force that's been meeting for the last 6 years. We have an opioid coordinator and a whole staffing unit. Homelessness, it would be impossible to quantify the amount of resources that have gone in from the county as well as many other partners into that issue. Racism, we have a racial equity program manager and a council that we've stood up, and a lot of work there and more work to be done. And then climate change, we have a climate program coordinator.
Climate change was for board, not BOH though.
I think it was both.
Both?
Maybe I'm wrong.
I think it was only for BOCC and not Board of Health.
Might be right
So
on that.
just, I would like to know how many declarations does the Board of Health actually have?
It's a pertinent point, because the point is, when we do it, we try to be really serious about it. We don't just do it and then we're off doing something else. We staff up an entire program related to, that's been the recent history. So we have to talk about, do we have the capacity to do it here, or are we gonna do it differently, or is that a reason not to do it? I mean, that's the debate or the discussion that needs to happen.
Resources that the Board of Health want to put into it, because we can't just say we're gonna take these action steps and
Without
then
any resources.
without any
Without a
resources or any support for staff. So I think it's a good conversation to have, but I think we need that information from staff to provide to the board of like, these are the current declarations that are out. This is kind of, you know, if we were to do this, this would be the action steps that we would need to take and the resources that would need to be allotted to something like this.
See, Commissioner.
I think this is important, and I appreciate all the things you guys are saying. But I you know, pointing out that the mission kind of encapsulates, this is what we do, or, you know, this is something we do and something we value. And so I would love to look into what we're already doing, like we're promoting events throughout the community, and we've got a proposal to bring in more LTAC funds to be able to promote more events and bring more people together. We're working on our park system, and like, if there's a way to bring you all in to help support the things that we're already doing before we start talking about, new things to do or new surveys, that I would be inclined to do that. And then, I take declaring emergencies very, very seriously. And when it gets mentioned something like the opioid crisis and the fact that that's still the leading cause of death in Thurston County, and it's ticking up, so, we haven't solved that one yet. So like, let's, I want to talk about the emergency that's already at hand before we talking about the next emergency. And, just the other day when I went out with the Nurse Family Partnership, they were talking about how infant mortality rates in Thurston County are the highest in Thurston County than any other county. I'm like, well, maybe, why aren't we declaring that an emergency right now? So like, there's a lot of important things to talk about, and this is important. So like, it's kind of a mixed bag, because where do you pick?
And I would hazard to guess, as not a credentialed medical professional, that the opioid epidemic and some of the poor outcomes we're seeing for neonates might be connected to
isolation
and loneliness, both of those things.
I would
Maybe.
agree.
Commissioner Edwards?
If we could rope Cheryl in, because she was originally in the group, I guess, we've kind of got a pretty good ready-made citizens committee to come up with something here to help us along on this. So expect maybe we'll hear a little more later on. Thank you for coming forward.
I would add one more thing, and that is, many things can be true at one time. We can be grappling with an opioid crisis and a crisis of homelessness, but we also do have local data that supports the urgency of addressing this crisis of loneliness and isolation just recently through our Healthy Youth Survey and our Community Health Needs Assessment. And to sort of piggyback on what you said, these things are often very interconnected. And so I don't think that we acknowledge one crisis to the exclusion or diminishment of another crisis. I think that we can acknowledge multiple things at once, and our response doesn't necessarily have to be equivalent either. The millions and millions and millions of dollars that are being invested in addressing homelessness and the opioid crisis and climate change, that doesn't necessarily mean you have to marshal the same types of resources to address this. But it also means that, we can walk and chew gum, we can do more than one thing at a time, and we can address more than one issue at a time. And in fact, I would even argue that that's pretty much the function of every person here in government at each of our organizations. We don't focus on something singular. We're juggling a lot of different priorities, and that's our work, that's our business, it's what we do, all of us here.
See,
Just a potential suggestion, if it is the will of the board that the public health staff can potentially meet with our proponents to better define what it is that the ask is in terms of whether it's a declaration or have that conversation to iron out the expectation about resources, so that we can bring that back to the board for consideration, and also that it internally, given that we have other constraints as well.
Could we also have sort of a list of what programmatic stuff you already are doing that you think links to this topic?
some neutral faces and some nods.
Sorry, I missed your question.
If they could link like what they're already doing in the county programmatically and spending money on that is actually working on this issue already.
To Wayne's point.
Because there are several
It is
things.
intertwined, and like, I went out with the nurses the other day, and
Because
they're.
maybe what it'll end up being is more of a broad community collaboration of trying to fill in all the pieces of getting the messaging and then also making sure the services are to all the different groups.
Probably Dr. Jen needs something else to work on, isn't it?
She almost smiled when you said that.
I think there's a humbling element of this that I take on, and that is that though my organization for 50 years is trying to support seniors and having a high quality of life, you could honestly say that there are ways we've failed. We've succeeded countless times, but senior isolation is worse today than it was 50 years ago. There's no arguing that. And we see it. We see it with meals, and we see it. We survey it, we see it. So it's everything we are collectively doing, and we're doing so much. We have the best YMCA down here. I mean, we have incredible organizations, and we're not succeeding at keeping people connected enough that it's succeeding, right? And they don't know that it's a health concern, which is what we said at the start. People don't know that being lonely is, so I just put that out there, that even though we're doing so much, we have not moved the needle, and people don't know that they need to be that concerned about it yet.
Can I ask you, Brian, one thing I'm curious about is, in terms of the idea that it's worsening, and like, I know a lot of seniors, like family members that I have, and because of cell phones and Skype calls and stuff, like there's way more contact among family members, at least in my circles, than there ever was when I was a kid. So my question is that just not high quality? Is it not enough time? Is it not a high quality enough contact? And other forces are kind of, that's helpful, but there's other stuff that's making it worse? Or is that just making things worse in some other way, like it's a substitute for some people? I mean, I've got a lot of people scattered all over, so it's not a substitute for anything. I wouldn't talk to those people, but now I do. Like my mom and I text every night. Without a cell phone, I would never talk to my mom every night. My wife's from Bulgaria. She Skypes with her mom every night, video phone, for like half an hour, 45 minutes. Now, it's only half an hour and 45 minutes. She's got 23 other hours of the day to fill in, but I got to believe that that's better than the past. So I'm just wondering, how do you think that technology fits into this whole picture?
I appreciate that you're asking me, but you all know full well that I'm not the expert on that.
But it's a lot of anecdotal.
But it's a great question. We have more connection than ever, just like you're saying, Ty, more connection than ever. And the Surgeon General has now declared it an epidemic, and the research says that it's worse.
Yeah.
Well, and I would add.
That's the.
Raise your hand if you ever work from home.
In your life?
Like occasionally. I mean, is that a part of the equation too? Now, like work from home is a big thing and everybody's okay with it, but at the same time, where do you get most of your social interaction? And I know we're not just talking about seniors.
Yeah.
Most of your social interaction happens at work, but who's gonna go back to their workplaces and say they wanna eliminate work from home?
And stories of people who did remote work who are now trying to get back in the office some, right? Because they recognize that it's not always great to just sit at home and work from home.
Well, and I would say too, what that overlooks is that there's 20 to 25, maybe 30%, depending on where you are in the United States, of people who do not have access to reliable internet. They don't have a basic cell phone plan, so they don't even have that degree of connectivity.
Which brings in the intertwined thing. We're working really hard on
Yeah.
on rural broadband,
Right.
which would be an excellent thing to say. we're
Another way to
against
use within this
isolation.
crisis or declaration, whatever we're gonna call it, that, these are the things that we're doing to move people closer together.
And then also the bad impacts of tech.
Right. That could be contributing to that.
Children having a phone in school all day.
Yeah, I can see with youth, it seems like it's definitely negative. With seniors, I could see how
Yes.
it could be
But
considered
they're
a
not the ones
positive.
that-
Well, it's like everything. It's like if you use it in a good way.
Yeah, sure. It can be.
So,
In 70 years, when the youth are using the iPad.
see how it goes.
Yeah.
I really appreciate this discussion. I don't want to cut it short, but I want to make sure that we have a chance to get to the other items on our agenda. I heard Assistant County Manager Gilder ask if we wanted to explore this further, have county staff connect with you all and talk about an opportunity, maybe, see what it would take to take this on as a declaration or in some other format. And I think I would like to have that happen and then maybe hear back on it. Does that work? So let us continue the conversation. We'll keep talking about it, figure out what we all can do together and partner on this.
Thank you.
Thank you.
Thank you so much for coming forward.
Look at, we got no photo though.
Oh, man,
The photos for soon when we
Yeah.
put something to paper.
Happy to pass. Have a great day, everybody.
Thank you. Thank you for being here. Well, I loved that discussion. It's a heavy topic, but it's an important conversation to be having. So next on our agenda, something a little less complicated, electronic signatures. Did everybody have a chance to review the electronic signatures policy if you wanted to? Okay, so the question at hand is whether or not we would like to adopt electronic signatures for future Board of Health decisions, signing proclamations, that kind of thing. And I suppose I would just open it up for comments, questions, or discussion on that. Jacqueline, do you have anything you want to share with us about adopting electronic signatures?
No, the only thing I would add is there is a form that will need to be completed and signed for our non-Thurston County folks, so that I can send out for you guys to complete. There is a white piece of paper somewhere. If before you leave, if you could sign it, that way I can scan and snip it, and we have your signatures on file.
So I believe that we will need to update our bylaws to include maybe one sentence just mentioning that we use electronic signatures. Because in the electronic signatures policy, it says that the board or elected official needs to approve the use of electronic signatures. So the way that we would do that is us here updating our bylaws that we just passed last month with another sentence that says we use electronic signatures for Board of Health stuff. Is everybody comfortable doing that?
So just for clarification of how it would work, is it sort of like a DocuSign, like where we click that we agree and are okay, or is it?
Nothing so fancy as that.
Okay.
That's why we pass
So-
around these pieces of white paper.
So the only thing, as a person who, could prescribe with my signature, things like that, like, I'm just very hinky about making sure I'm okay that you're using my thing and that I know what it's going on. And so I don't know how we do that and assure that, but that would just be my only thing. Obviously, it's more convenient, and if it's a proclamation and we've all agreed to the proclamation, no worries,
Be, I think, only in the scope of Board of Health decisions, things like proclamations mostly. And the authorization form will outline like when the signature gets used, what it's used for, and what it cannot be used for.
And only with the person's consent.
Correct.
Great, yep.
So, would anyone like to make a motion to amend our bylaws to adopt the electronic signatures policy for the Board of Health?
Or would we direct staff to amend the bylaws and then come back and we would review that amendment?
Could do.
I'll make a motion to direct staff to amend the bylaws to allow us to use electronic signatures.
I'll second.
And moved and seconded. Any discussion? Seems incredibly straightforward versus the last agenda item. All right, all those in favor of the motion, please say aye.
Aye.
Any opposed? Nope. So, Jen, can you bring us an updated version of the bylaws? And perhaps, in the meantime,
Probably had to, correct.
we can do more than one thing at once, so maybe we can also send out the authorization forms, and folks can at least look at them before we pass the language in the bylaws next time. Okay, next up on the agenda, Board of Health Strategic Plan Subcommittees.
Yes, thank you, Board of Health members, Dr. Jen Freiheit. And this is really the time where we can put names to committees. My recommendation is we have 3 strategies. One is on data, one is on policy, one is on education. All of the proclamations for the year that have been worked out ahead of time, all presentations have been tied into the strategic plan under one of those 3 categories. So after there's some more internal talk, for example, about the loneliness and isolation, that can go under a subcommittee as well too, wherever you deem it necessary. And so my recommendation would be those 3 subcommittees to start. And then once the subcommittees get together, and if 2 need to combine, or one is only a temporary for 6 months and then dissolves, whatever is determined at the subcommittee level.
Can you repeat the 3?
Data, essentially broken down into one word: data, policy, and education and outreach. With 3 strategies, and then 2 goals under data, 1 goal under policy and 2 goals under education and outreach.
Somebody mentioned that there are draft charters, so if you volunteer for one of these committees, you will not be starting from scratch on figuring out what it is that you're doing on the subcommittees, because we have draft charters to work from. So shall we begin by taking volunteers for the subcommittees? Does anybody have any particular interest in any of those 3 named subcommittees? I want to be on data.
I'll volunteer for policy.
I volunteer for data.
I'm interested in education and outreach.
Should be writing this down.
You can put me on data as well.
Education and outreach.
I don't bite, guys.
Ty's alone on policy.
I like data and education and outreach. Can we do 2?
If you want to show up to both meetings, sure thing.
I like both.
All right.
And speaking of the both, if this de-isolation turns out to be a group, I would be very interested to participate in that.
I think I'm with Heidi on that. I think it's really worth looking into. I suppose because of the demographic I represent.
I was recently volunteered for a ton of committees, so I'm gonna wait and see how this all shakes out, because Commissioner Mejia signed me up for about 5 different things in the last month.
I wasn't the one who said, sign me up. I'm just happy to
Still don't even know what an
volunteer.
internal audit committee is.
So let me see, I don't think I got everybody who volunteered for everything. I've got Robin and Perla for data. Somebody else said they
I
wanted to be
said
on
data
data.
as well.
Lynn. Got Ty on policy.
Forget what our,
I appreciate the
What
vote of
are-
confidence. You're gonna let me set county health policy?
I forget what our, yeah, like what our,
Yeah, that would.
What the sub goals
the,
are.
the goals, yeah, because I think depending on the goals, I
Education
might
and outreach, and I'll go to policy.
So Carolina and Emily are on education. And did you say you wanted data also, or did you say policy? Okay. You know what? I'm gonna switch, even though I love data, I'm
Yeah.
gonna switch to policy. I'll join you, Ty.
Well, I was
There
like,
will
I
be
can join.
great
You can
overlap.
stay on data, because you really
On
like
these
data.
committees.
I'll move to policy.
Okay. But then we need
No
somebody else.
data is
that-
gonna be allowed in our.
Our
policies.
policies.
That's for the data subcommittee.
The really clear lines. Well, Carolina's shifting to policy, so now we have a little bit of a gap on education. Anybody?
Did you say?
Education? Okay.
Just for review on the data strategy, goal 1.1 is to increase data visibility in the community. And goal 1.2 is to use data in policy planning and development. Overlap. Strategy 2 on policy and research is 1 goal. 2.1, establish a system for policy support and development. And then strategy 3 on education and outreach has 2 goals. 3.1 is to build public trust and provide regular, timely, and effective information to the general public and partners. And goal 3.2 is to build and strengthen community partnerships to enhance collective impact strategies.
Didn't we add language to the policy goals? Like, did we just tweak the one that's there? I thought we added.
We added goal 1.2 up under the data because that initially only had 1 goal. So it got a second goal.
Did you?
And I do believe that when the subcommittee starts sort of, fleshing out their work, that there may be some overlap, and so we'll just have to figure out, but that's where Jacqueline, as the Board of Health Clerk, will ensure that everybody is on the same page and knows what the other committees are doing.
So I also heard some interest in perhaps time-limited committee to explore the loneliness and isolation concern that was just brought to us today. And I heard Commissioner Edwards and Heidi both were interested in getting together on that.
If I could just make a recommendation, because we worked hard to make sure that any topics, so for example, when we've had the STI topic or Ben Miller-Todd with Narcan on the units. And so we've tied all of those into one of these 3 subcommittees. And I think the reason that that is really important is to make sure that as the Board of Health and as these subcommittees, we don't bite off more than we can chew. So that in the subcommittee, we can determine, okay, of all the topics that we wanted to talk about this year that we've heard from, what are the ones we really need to focus on, because it's a 2-year strategic plan. We can't achieve everything, so there will have to be some limiting and some narrowing of focus. So my recommendation would be that if this is a particular topic of interest, that we tie it in, I think.
Existing subcommittee.
Right. Education outreach, I think, was one of the first things they talked about of, marketing campaign or something.
Opportunity.
Land there.
It might go there, yeah.
And also you'll need the data. I feel like each subcommittee could look at loneliness.
Yeah, I feel
There
like
will
it
be
straddles
overlap,
all
yeah.
three of them.
Okay. So Gary said education fits for him. Heidi, you were already on the education list. That brings education to 3. You've got Ty and Carolina in the policy bucket, and myself, Perla, Lynn, and Emily in the data.
And I just don't know
You were
where
on
I
policy
belong.
too, weren't you? Didn't you?
Well, I
Policy.
was willing to shift, but.
Oh, okay.
Well, and I think my problem too is I'm pretty booked out, and I would be a little bit hard to add another committee, but I feel like I could contribute to any of them if I felt like it would be helpful.
And it could become a standing agenda item where Jacqueline can bring back the issues and the decisions from the subcommittee so that you all are aware. You can jump into other ones at that time.
Maybe you could be the SME for the policy committee. You don't have to attend the meetings, but you could do the review. Jacqueline, did you get that? My notes are not very pristine, but there's something anyway. So what I'm hearing is that we've got 4 people on data, 2 people plus a potential reviewer on policy, and 3 people on education.
I'd like to be added to education.
Education, okay. All right, and that's that natural connection point. Educating about data is the first strategic sub-goal in data, and we've got Perla and Emily who will be on both of those committees, so there's that nexus happening already. Okay. If you decide later that you want to be on one of these committees and you didn't put your name on, you can always jump on later. But what are the next steps? Should the committee members work together to schedule an opportunity to meet and discuss their charge?
I would propose leaving that to Jacqueline, who will do doodle polling or however you want to do it.
Great, that'd be
Make
so
it
much
easy
better
on
than
all
us
of
having to do it. Thank you, Jacqueline.
She will be creating agendas and minutes and keeping all the records of what you discuss at subcommittees. So.
Amazing. Okay. I think we have subcommittees. I don't think we need a motion. We're good. Thank you, everybody, for quickly volunteering to get into those buckets. All right, next item on the agenda, we're coming close to the end. Open board discussion and information sharing.
I have 2 things. So I did a ride along with the Nurse Family Partnership, and it was absolutely rewarding. And I want to spend time learning more about it. But one thing I want to share with everybody that the nurses said that I thought was really cool was that it's really hard for them to get into doctors, and they mentioned one doctor right there. They will always accept one of the patients. And I thought that was awesome. So it was very clear. So thank you, Dr. Harvey. And then I don't know if this is premature, but there's a director vacancy, and I don't know how this group meets and hears from the county manager on our plan, or if it's premature, or what's happening, or how they weigh in on it. But is there any update from the direction on that?
Thank you so much, Commissioner. So we are extremely grateful to Dr. Jen Freiheit for stepping in and taking the helm as interim. The approach and plan is to provide some stability over the next several weeks to months and allow her as an interim to get established. And then that allows me as a new county manager and assistant county manager, Rob Gelder, to assess what the department needs. I think there's a lot of opportunity, as we're finding out, in public health. And we are appreciative of the direction setting that the former director, David, established. And so we need to assess where we go from here. The fortunate thing is because Jen has been involved over the last, 14 months. We have a good sense of things that need to continue to be advanced. It is a extremely important department with a lot of different things going on in that department. And our initial approach is going to be to assess all those different division and programs and look at what level of management structure and support is being provided so that we can make sure that things are moving forward in a very positive and productive way. And so I am also grateful to the Assistant County Manager, Rob Gelder, who has been spending quite a bit of his time. He has a portfolio of a lot of departments, but he's been spending quite a bit of time working with Jen to provide some support. And we'll continue to do that, and we look forward to coming back in the next several weeks and months after consulting with the commissioners on what our next steps are.
Thank you. That's all I got.
Anybody else got anything to share?
We had our second student health collaborative. Actually, I think it was the night of our last meeting, right? And several commissioners and members of this board were there, and several public health staff. Really well attended. The focus was getting students ready for school next year related to health needs. The Washington chapter of the AAP funded those beginning steps, and their grant ends the end of June, I think, maybe July. So the ESD is going to take that work on going forward. I think there is a really nice opportunity to partner with public health going forward, and to stretch you guys a little bit further, to add one more thing to your plate. But it was really well received having public health there. That was not part of the original planning, but it turned out to be such a valuable piece of it. So,
Is there going to be a third session?
so we meet this Friday to plan for next year. So yeah, but not until the fall, and probably not until October. That's Lynn's opinion, but September's just too crazy.
Yeah, I attended that event as well, and it was really, it was neat to see so many different groups in the same room talking to each other about like challenges that you face, because we had Dr. A there, we had Jen there, I attended, some folks from my agency came and talked about Apple Health and like opportunities for coverage under Apple Health, which is Washington's Medicaid program, and just hearing nurses talk to providers, talk to public health about some of the shared barriers and opportunities was really neat. Like, I love that public health can be a part of that. Any other sharing? Speaking of my agency, the Apple Health Expansion Project goes live on June 20th. If you have not heard about that, that is expanded access to a program similar to Medicaid for undocumented immigrants. So folks that wouldn't have access to medical insurance in any other way are now, there's going to be a pilot of an opportunity for folks to have access to benefits. And the soft launch is June 20th, and then it goes fully live on July 1st. It's very exciting.
I would love to talk to you more about that.
Yeah, I am super not the expert on it. I'm just an enthusiastic novice. I'm sharing, and that's about all I know about it, but I'm excited.
Where can we find more info on that?
If you go to hca.wa.gov and type in Apple Health Expansion.
Thank you.
Yep.
There's a cap on it, and it's expected to fill up fairly quickly, so if people know people who need to get on there at that soft launch date. Yeah.
Taking a look as soon as June 20th. All right, well, I guess we can proceed to the next item on the agenda, which is the health officer's report. And you had the health officer's report in your packet, so hopefully folks had a chance to take a look at that. Dr. A, is there anything you want to call out on that report?
No, just, it was, just wanted to highlight that we did see a little bit of a cluster of acute gastroenteritis cases that dovetails with the work that our teams are doing around food safety and environmental safety as well. In addition to our communicable disease team providing guidance to facilities to stop spread. I also just wanted to call out a little bit about vaccine preventable illnesses. We do have 2 vaccine clinics coming up towards the end of the summer. So one at North Thurston High School on August 15th, one at Grand Mound Elementary School on September 13th. And then just wanted to share that folks, community members that would like additional vaccination support, that the Washington State Department of Health has a program, the Caravan program, that can help support. And I believe, so I think those are the ones that have been finalized so far, and I believe there may be one other request that we're seeing if we have capacity to meet as well. But I think those are the highlights, especially in light of the recent measles exposure in SeaTac Airport. There are vaccine preventable diseases that we're seeing in Washington State, and so there's never been a better time to support vaccine in our community.
Measles in particular seems like one of those diseases that we have teetered on the brink of exterminating for a long time, and yet it keeps popping up. So get your measles shot, everybody.
Have there been any cases of measles connected to that SeaTac Airport exposure that you're aware of?
Not that have been shared with us, and not in our county.
All right, thank you. Next up, interim director's report. I was given to understand you don't have
a report. I'm a week and a half into this, so I apologize. I didn't have too much to share other than what you already know, but there are some things on the second page of the health officer's report that we just wanted to add in there, but I will have hopefully a much more comprehensive report in August when we meet again.
Okay, thank you, and good luck. We've reached the end of our agenda, so I think, Commissioner Edwards?
I just have one quick question. The last page of our packet has got the sales and use tax report. And I'm just curious what it's comparing to, or any explanation.
I don't think my
Mine
packet has that.
accidentally got picked up from my desk.
The rest of us don't have it.
Secret.
It was an accident.
That nobody else has.
It was on my desk and I probably accidentally stapled it with the packet.
Way to confuse Commissioner Edwards.
So now I will say you were very successful in confusing, because I couldn't come up with anything relative.
Her grocery list.
Next item on the agenda, we're gonna
Okay.
talk about taxes.
Dr.
No, we're not.
is waving her hand at you.
I wanted to share one more thing about, just because we're doing the health officer report and the director report in a little bit of a different way as a written report. I did want to share that we do have, in addition to immunizations, we do have a number of other community programs like our bereavement support group being a significant one, lactation support, postpartum and parenting, just tying into the loneliness and isolation piece, as well as our environmental health of folks, having homeowner septic self-inspection certification workshops, and then healthy home and yard workshops that are also are all things that ways that we're supporting our community. I think I definitely would love to hear feedback as we kind of move in a new direction on these reports, but but my thought was to share all of the work that we're doing in the community with you, and also so that you all have this information to share with other community members, so that just so that folks have full visibility on different opportunities that they have to connect.
My feedback is that I really like having it in this written format so that I can review it and ask questions and follow some of the links if I want to learn more. So thank you for preparing this. Anything else? All right. Well, thank you very much, everybody, and I'm going to call this meeting adjourned.